Welcome back to MediVista, where health is explained simply, clearly, and honestly. I'm your medical guide, here to break down complex health topics into language anyone can understand, because everyone deserves to know what's happening inside their own body. So sit back, and let's learn together. Right now, as you watch this video, millions of people are walking around with dangerously high blood pressure, and they feel absolutely fine. No pain, no warning, nothing. Until one day, without any notice, they collapse from a stroke, or a heart attack, or their kidneys silently fail. 1.3 billion people worldwide have hypertension. In India alone, that is 1 in every 3 adults. And more than half of them have no idea. I'm going to show you 8 warning signs your body is already sending you. Signs that most people completely ignore. Stay till the end, because the last 2 signs are the ones doctors say people miss the most. Sign number 1, severe headaches, especially in the morning. If you wake up with a heavy, throbbing pain at the back of your head, do not ignore it. During sleep, your blood pressure naturally rises in the early morning hours. In people with hypertension, this rise can be dramatic, causing intense pressure headaches that ease slightly as the day goes on. This is very different from a normal tension headache. If this is happening to you regularly, check your blood pressure immediately.
Sign 2. Nosebleeds.
Sign number 2. Frequent or heavy nosebleeds. Now, most nosebleeds are harmless. But when blood pressure is dangerously elevated, above 180/120, the small blood vessels inside your nose can rupture under the pressure. If you're having nosebleeds with no obvious cause, no injury, no dryness, and especially if they are difficult to stop, that is a red flag that needs urgent medical attention. Sign 3. Blurry or double vision. Sign number 3. Changes in your vision. Your eyes contain some of the most delicate blood vessels in your entire body. When blood pressure is consistently high, these tiny vessels get damaged, a condition called hypertensive retinopathy. You may notice blurry vision, double vision, or even sudden vision loss in severe cases. This is extremely serious. Untreated hypertensive eye damage can lead to permanent blindness. If you notice any sudden change in your vision, please see a doctor the same day. Sign 4. Chest tightness or palpitations. Sign number 4. Chest tightness or a pounding heartbeat. When your blood pressure is high, your heart has to work much harder than normal to push blood through your arteries. Over time, this extra workload causes the heart muscle to thicken and enlarge. You may feel this as a tight pressure in your chest or notice your heart beating unusually hard or fast, even when you're just sitting still. Never dismiss chest symptoms. Should you experience chest pain accompanied by shortness of breath, please contact emergency services without delay. Sign 5. Dizziness and lightheadedness. Sign number 5. Dizziness and lightheadedness. When blood pressure fluctuates, rising suddenly or dropping after medication, it affects blood flow to your brain. You may feel dizzy when you stand up quickly, feel unsteady when walking, or experience a spinning sensation. Important note: dizziness can also be caused by blood pressure medication that is too strong. If you are already on BP medication and feeling dizzy, speak to your doctor about adjusting your dose. Sign 6. Shortness of breath on mild exertion.
Sign number 6. Getting breathless from doing simple things.
Climbing one flight of stairs.
Walking to the kitchen.
Carrying light bags with blood. This is called left ventricular hypertrophy, and it is a serious complication of long-term uncontrolled hypertension. Sign number 7. Facial flushing and excessive sweating. You may notice your face suddenly turns red and feels hot, especially after exercise, stress, alcohol, or even spicy food. In people with hypertension, blood vessels near the skin surface dilate and contract abnormally, causing this flushing response. Sweating heavily without a clear reason, or waking up drenched in sweat at night, can also signal that your cardiovascular system is under significant stress. Sign number 8, and this is the one that shocks most people: blood in the urine. Your kidneys filter over 180 liters of blood every single day. They are incredibly sensitive to blood pressure changes. When hypertension is severe or long-standing, it damages the tiny filtering units inside the kidneys, called nephrons. This damage causes blood to leak into the urine. You may see pink, red, or dark brown urine. Or in early stages, there may be no visible blood at all, only detected on a urine test. This condition, hypertensive nephropathy, is one of the leading causes of kidney failure in India. If you ever notice blood in your urine, do not wait. See a doctor immediately. What your BP numbers actually mean. Now let me explain what your blood pressure reading actually means, because most people look at these numbers and have no idea what they're telling them.
Below 120 over 80. This is normal.
Well done. 120 to 129, with a diastolic below 80. This is elevated. Your blood pressure is creeping up. Lifestyle changes are needed now. 130 to 139 over 80 to 89. This is stage 1 hypertension. You need medical guidance and possibly medication. 140 over 90 or higher. This is stage 2 hypertension.
This is serious. You need to be under a doctor's care.
And 180 over 120 or higher. This is a hypertensive crisis. This is a medical emergency. Go to a hospital immediately. Do not drive yourself. The most important thing I want you to take from this video is this: check your blood pressure regularly, even when you feel perfectly fine. Because by the time you feel symptoms, damage has often already begun. High blood pressure is not a death sentence. It is manageable, with the right knowledge, the right lifestyle, and the right medical support.
Reduce your salt intake.
Exercise regularly. Manage your stress. Sleep well. And if your doctor has prescribed medication, take it consistently every single day. If this video gave you valuable information, please share it right now with your parents, your spouse, your friends, anyone over 30 who hasn't checked their blood pressure recently. It takes 2 minutes to share and could genuinely save a life. Subscribe to this channel for more medical knowledge explained simply and accurately by a qualified medical professional. Take care of your health. I'll see you in the next video.